Good afternoon to everybody present here and those online. So this is our very first seminar for 2023, and welcome to this MSSRF seminar. We have a very eminent Professor Sumantra Ray here, who will be talking today, and he's the founding chair, chief scientist and executive director of NNEDPRO Global Institute for Food, Nutrition and Health in the UK. First, before we begin, we'd like invite Dr. Hariharan to give a small welcome note, please.
Thank you, Sangeeta. Indeed, it's my pleasure and privilege to welcome two important guests for this seminar. First, I welcome the speaker, Sumantra, Professor. Thank you very much for accepting our invitation. He was telling us that for the past 4 years, he wanted to be here and start his discussion with MSSRF. Today it happened. We had a wonderful meeting in the, before lunch we had a meeting, and very good interaction happened. It gave us an opportunity to interact with you, as well as we also able to show you what are all the things we are doing. In fact, we are looking forward to hear you on the seminar on possible areas of collaborations as well. Amongst us, we also have Dr. Soumya Swaminathan. She needs no introduction to this audience. She has taken over as trustee of the foundation. So on behalf of all of us, Madam, welcome you to this important seminar. And speaker introduction will be done by Ms. Sangeeta, and I request Dr. Soumya to chair this seminar and conduct the proceedings. With these few words, I sit and thank you.
Thank you, Dr. Hariharan. So I'll just introduce the speaker to begin with. Professor Sumantra Ray is the founding chair, chief scientist and executive director of NNEDPRO Global Institute for Food, Nutrition and Health in the UK. He is the director of research in food security, health and society, School of Humanities and Social Sciences in the University of Cambridge, and also the professor of global nutrition, health and disease in the School of Biotechnology Sciences, Ulster University. He is also the visiting professor at the School of Public Health, Imperial College of London, and the co-founder and chair of BMJ Nutrition, Prevention and Health at a British Medical Journal group. Today, the speaker will be talking about nutrition security and the translation potential of mobile teaching kitchen initiative. So welcome, Dr. Ray, please.
Thank you for that very kind introduction, and it's really a great honor to be here at the MS Swaminathan Research Foundation. And I've been following the work of obviously MS Swaminathan, the foundation, and all of the wonderful people involved for many years, and have been planning, as we've been collaborating with the foundation through something known as the Tigris program, have been planning a visit for several years. So I'm absolutely delighted that it's happening today, but it's also happening at a moment when there are many different wheels in motion that makes it the perfect juncture for us to think about the translation potential of one of the initiatives that has been part and parcel of the Tigris program, which has brought us together with the MSSRF. So I'll broadly say something about nutrition security and then dive into what's known as the Mobile Teaching Kitchen Initiative. But before I do that, just a few declarations of interest and special acknowledgement to a huge number of people who've worked within and with our institute to make this work that I'm presenting to you possible. So I feel humbled and privileged to be presenting not only on behalf of the Institute, but on behalf of many, many individuals who are possibly too many to name at this moment. But before we go any further, I'd just like to share a very short video about who we are and what we do as a Global Institute for Food, Nutrition and Health. So if you could play the first video, please.
Hello, we're NNEDPRO, a non-profit think tank working on nutrition education, research and innovation, working towards tackling the global crisis of malnutrition in all its forms and accelerating progress towards the United Nations 2030 goals through research, implementation and action. To get there, we at NNEDPRO implement our research by educating health professionals and equipping primary caregivers with our insight on nutrition and well-being, by increasing public awareness about food choices, cooking and diet lifestyle patterns, how these behaviours impact our nutrition, and how certain diseases can be prevented. Nutrition. By forming interdisciplinary collaborations and influencing food systems from production through to consumption and beyond into healthcare, and by commissioning small but impactful ventures working towards improving public health. We deliver evidence-based education on diet to healthcare and nutrition professionals through 12 regional networks and currently roll out direct action or advocacy to improve the food people eat in nearly 40 countries. Each year, around 250 junior doctors and medical students participate in our educational programs, potentially improving the diets of up to 71,500 families each year. Moving forward, NNEDPRO will continue to operate impactful social ventures, conduct high-quality independent research, offer extensive education and training opportunities, and use our experience and expertise to provide advisory services where needed to achieve the UN 2030 goals of addressing malnutrition in all forms and facilitating sustainable improvements in global nutrition.
So I'm particularly pleased that this is the first talk of 2023 that we're doing, but also this is our 15th anniversary year, and very glad to share that with MSSRF and all of the stakeholders who are attending today. That we were originally founded in 2008 as a small group of individuals who were looking to join up the different elements that could bring together food and nutrition, medicine and public health, and also community development. And today we are really privileged to be operating in over 40 countries through 12 regional networks with over 700 members by invitation, of which just over 60 form our core and are spread over multiple continents, including a key contingent in India. And some of the subsidiaries that we are responsible for include not only what is now the Mobile Teaching Kitchen International initiative, but a flagship journal with the BMJ and an international academy of nutrition educators, which seeks to roll out nutrition capacity building in an interdisciplinary format. So one of the key elements of this international operation that we have grown over the past 15 years is really our India and South Asia regional network, and all of the work that has become quite a constellation within India, not only for this region, but also providing models and examples to all of the other regional networks that we operate in. And across those networks are different cross-cutting activities which encourage interprofessional dialogue, which is really something that I see today as well, and raising awareness partly through advocacy, but also partly through strengthening the science behind some of the messages that we want to deliver. And just to give you a little bit of background, and perhaps many of you will be well familiar with this, we are obviously operating in a global nutrition transition. And this has been recognized quite a while ago. Probably it's something that has been documented for over 2 decades now. And in this global nutrition transition, you can see that as we went through different phases of evolution as humankind, from Paleolithic to the first settlements, industrialization, and then the age of non-communicable disease. And really, I would add another one to that, where given the recent experience of the pandemic, we've seen the importance of considering both communicable and non-communicable diseases together. We've ended up with what has been termed as a double burden of malnutrition. You may have heard some people refer to this as the triple burden, but in December 2019, the World Health Organization classified malnutrition back to the double burden, because we need to think about doing double duty actions, and that is coming up with programs, initiatives, and interventions that address overnutrition, undernutrition, and the overlay of micronutrient deficiencies with either or both of those at the same time. And in order to do that, we need to think about health promotion and literacy in different senses. And that's really quite important for us to bring double duty actions and addressing the double burden of malnutrition into a framework that speaks to not only food security, but also nutritional status or nutrition security and the sustainability of both. And that framework means that we need to think, particularly, I speak for my own professional community, we need to think beyond the top end of this ladder, where we are just modulating dietary choices, nutritional status, and health outcomes, but rather think completely upstream to food production, what that does to nutrient quality, the food environment that that produces, albeit subject to supply chains, and of course, then look at how we can use nutrition knowledge at every rung of this step ladder, communicated in a different way for health promotion, and also set to different levels of literacy. With that, of course, we need to think about wider determinants, because we cannot simply consider diet and nutrition in isolation. So we obviously need to think about heredity, environment, other aspects of lifestyle, socioeconomic circumstances, and so on. But the important thing here is really this interdisciplinarity that allows us to take nutrition upstream to where food is being produced, all the way to where we are thinking about health outcomes. And bringing this into a preventative medicine framework, I think many will be familiar that health promotion is one of the key components of primary prevention before the appearance of clinical disease. So even if we're talking about a micronutrient deficiency, most of the population is probably suffering from one or more insufficiencies before that becomes deficiency. And we tend to focus quite a lot on secondary and tertiary prevention when the problem has already appeared above what we call a clinical horizon, so it's visible, but by that time it may be too late to actually mitigate the problem using dietary means alone. So bringing it back to primary prevention and health promotion, which is one of the powers that we all have as professionals engaged in diet and nutrition related activities, interfacing with the community, we need to think about literacy, but within that health literacy, and underneath that food and nutrition literacy. And very often the three are clubbed or conflated into one. So some may have high literacy, even high health literacy, but may not have the food and nutrition literacy that's needed. And that also applies to a number of different medical professionals, let alone members of the public at large. But of course, food is something that everybody needs to eat and everybody has an opinion on it. And so the perception of food and nutrition literacy is often different from the reality. And this triple consideration of literacy is fundamentally important to everything that we do that forms part of what I termed earlier as double duty actions, to always come up with strategies that address under and overnutrition plus minus micronutrient deficiencies together. Now, another overlay that we need to consider in this global burden of malnutrition is the element of inequalities. And of course, here are two countries that many of you will probably know the statistics from well, particularly for India, Nigeria and India, where we have similar levels of obesity and overweight on one hand, as well as stunting and wasting and micronutrient deficiencies. The factors that drive these are different, and more data will always be needed. But at the same time, we do have enough data to act. And that is where there is a responsibility that we have to come up with potential solutions that are transferable across borders, that act on the data that we have already, but initiatives that continue to add to that data so that we can maneuver as we go forward. And thinking of India, of course, as a case study, this audience will be well familiar with the answer to the question, is India on course to meet 3 of the global nutrition targets? So the answer is yes in some respects and no in others. So it's a complex ecosystem. So there can't be one answer to the question, because there are many examples of success, but also examples of where there are programs that have been in vogue for many years, but they're hitting a wall. And we need to ask the reason why. And that is where research and innovation can actually provide us with alternative solutions, that alternative or even adjunct solutions that feed into the infrastructure of the programs that already exist. So you heard me use this acronym TIGRIS earlier on. I'll explain what this is in a moment, but this is really one of the attempts to bring into existing frameworks new solutions based on existing data, but also based on new data that is now being collected in a way that will go into the future and continue to inform data-driven solutions. So this is just an acknowledgement to the different key organizations involved in Tigris, but also in the Mobile Teaching Kitchen initiative, which has been a sub-project of what we are terming Transforming India's Green Revolution Part 2. And it sounds quite profound to say this here at the MS Swaminathan Research Foundation, which means that the Green Revolution was not something that just happened. It's something that needs to continue to happen and continue to evolve for empowerment and sustainable, in this case, food supplies. So Tigris, as we have fondly learned to call it over the past 5 years, has involved MSSRF in multiple aspects of these six flagship projects, but particularly where we have interfaced is impacting well-being in both rural and urban communities, and the Mobile Teaching Kitchen is a subset of that. So this is where I will share a short second video to give you an overview of what this Mobile Teaching Kitchen initiative looks like, and then explain how it all began and where it's reached.
Across India, more than 1.5 million people live in 3,500 unregistered slums. An assessment of levels of nutrition and health education in urban slum areas in the city found that 85% of mothers and children were malnourished. We've been studying core scientific principles to tackle malnutrition, but this knowledge turns out to be complex and difficult to translate into practical advice for the broader population. This is where our Mobile Teaching Kitchen comes in. We have found a way to deliver nutrition education through demonstrations where we can empower people from marginalized communities into nutrition educators and micro entrepreneurs. With the help of nutritionists and public health professionals, the women and mothers of these communities are trained to become MTK champions, who then serve accessible yet carefully planned nutritious meals, distribute knowledge and practical skills, and bring revenue back to their communities. Currently, our MTK champions are affecting the lives of more than 3,000 people. With just 6 champions, we have the potential to impact 500 people per week and a staggering 24,000 people a year, not just by serving nutritious meals, but also sharing their knowledge about nutrition with their peers and community at large. With its success in Kolkata, the MTK is adapted and piloted across 12 regional networks spanning 6 continents. With your help and support, the MTK can achieve its goal to be a safe haven within the slums, supporting mothers with limited resources to achieve the best nutrition for their children and families.
And in case you're wondering, that is not Big Ben in London. That's actually a replica in Kolkata, probably an ode to its colonial past, but it's promising, I dare say, new future. So the mobile teaching kitchen model was started in Kolkata, India, and it had its seeds from the World Congress of Public Health, which was hosted by India and located in Kolkata in February 2015. I don't know if any of you were there, but really that is when a challenge was set to undertake a local initiative that was geographically focused and to build a model that was disruptive to some of the assumptions, but one that had enough depth of data to be able to create transferable solutions or suggestions of solutions, not only for this city, but others and beyond. So the basic principles were started pre-Tigris with support from the Economic and Social Research Council in the UK and a variety of other stakeholders and supporters, engaging with local communities. And through Tigris, that graduated into the actual piloting and delivery of effective nutrition education using nutritionally balanced, locally sourced, and very importantly, affordable meals. And all of this was really seeking to disrupt what has often become a vicious cycle of intergenerational poverty, whether that's inner city poverty, suburban, or even rural, by actually using a theory of change that is based on skills and livelihoods that brings nutrition and health with it. Because obviously, if we go into a community and say, hey, sorry, you don't have a job, you don't have a means of income, but we want to tell you what to eat and how to improve your health, that is obviously not going to hold any water. But if we say to people, and mean it, of course, that we're going to upskill them, give them a source of sustainable livelihood, and at the same time improve their nutrition and health, that of their families, that of their children, and that of the community, and give them a purpose in society which goes beyond just a vocation, and give them a mission, then that begins to hold some water and promise. And when you translate that into a rural setting, that also goes beyond the food sourcing, preparation, and food enterprise part, actually to food production, changes in decisions on land use, through to changes in agency, particularly for those who are disempowered in the farming community, including women. So the central model behind all of this is see one, do one, and teach one. And in this model, there are a few key steps. So in the first step, dietitians and doctors participate along with community workers in a multifaceted needs assessment. So in that needs assessment, we look at what the expressed as well as normative needs are in a community relating to nutrition, the burden of malnutrition, and other associated health and social issues. On collecting that information, the second dimension of the needs assessment is really a very extensive collection of local recipes, and we continue to collect those recipes until we achieve saturation, such that we gain a very good idea of the local dietary pattern, and based on that we can disaggregate and reformulate those diets at a later stage that forms the second part of the intervention, which is really the training of volunteers. Contemporaneously with all of this, we measure knowledge, attitudes, and practices relating to nutrition and associated behaviors. And we also measure constructs of educational, constructs taken from educational psychology, particularly cognitive flexibility and mentalizing skills, which tell us about the readiness of an individual or a community to receive information, to make changes, and whether or not that is going to be suitable for onward transmission. And if so, would that be reliably transmitted without that information being adulterated in the process? So a lot of measurements go into that first stage of needs assessment, which generally we're fairly quick. And the reason that dietitians and doctors are involved is because, as I said, we can't look at just nutrition in isolation. We also need to look at other surrounding problems, whether they're health related or indeed to do with social issues. So aside from dietitians, the local volunteers that we involve are those who to impact some of the social empowerment levers which are necessary. Champions. So with just 6 champions, we have now data from the past 4 years that demonstrates that we can impact 24,000 members of the public per annum. So we have now, I'm very pleased to share, collected data from more than 100,000 members of the public in Kolkata city, as the mobile teaching kitchen serves different areas of the city and serves up not just low cost, but highly nutritious, tasty, and socially acceptable meals which are sustainable. And with each meal, they also serve health education and collect data on the public understanding of the education, but also on the sensory preferences of the public. And those constitute the key elements of the micro enterprise phase, which stems from the needs assessment and the training. So based on all of that, there are 2 peer-reviewed papers so far. You can scan this QR code if you'd like to read one of the papers that describes the underpinning methodology that led up to the microenterprise. And now we are busily analyzing data from over 100,000 individuals to write up a microenterprise paper, which will tell us how the public have actually received this, what has worked and what hasn't, but also whether the microenterprise model can be made financially sustainable by actually taking it in one of several different possible directions. I also just wanted to acknowledge that in this, we listen to the voice of children, particularly through our junior ambassador, and that has been invaluable in shaping the entire initiative, because the children in this community have been an informal but not at all ineffective pillar of support for all of the mothers from that community who have become mobile teaching kitchen champions. So after this initial running of the needs assessment, Sodoto and microenterprise in Kolkata, as that initiative continued to grow and evolve, we were challenged through the Tigers program to run 2 adaptations, a rural adaptation in the Fatehgarh Sahib district of Punjab, where we worked with the Cordia colleges and Punjab University, and also an East Delhi suburban adaptation where we worked with an agency known as Vertiva, which is an environment NGO in Delhi. And aside from learning a huge amount about the difference between socioeconomic constraints and lack of agency, we also were able to gain key insights into some of the barriers and facilitators which are entirely different for rural areas. including the seasonal accessibility of foods, but also in suburban areas, some of the very strong influences that prevail upon the community, particularly in East Delhi, which interface with multiple different political axes. And so this really led to engaging with a very different, with two very different sets of stakeholders, but very surprisingly, despite the differences in sociocultural milieu, the transferable elements of the Sodoto worked equally well in both of these locations, and they led to slightly different outcomes, where in rural Punjab, the women have formed a group that actually provides a tiffin service to college students. So it's a different form of microenterprise. And in East Delhi, interestingly, the women who were trained and the champions from Kolkata were taken across to train them. They have formed a group which not only provides a tiffin service, but it provides it to schools, but not in order to supply food to every child, in order to provide examples of how the schools can modify their midday meal programs, particularly those schools which are currently supported by the Delhi government. Earlier this year, or rather last year, I should say, in the latter part of last year, we evaluated with field visits the work in Punjab and Delhi. And I must say that although the outputs were entirely different, the processes were much the same, and the outcomes in terms of upskilling and knowledge transfer were actually very similar and profoundly impressive, thanks to the initiative that these women took once they had gained that agency. And again, as I said a moment ago, we learned that even in higher socioeconomic groups in those parts of India, the negotiation to get to giving women that voice was quite different to, for example, West Bengal, where socioeconomic circumstances were the main barrier rather than agency. So different barriers, but similar solutions that seem to cut across. So these are the 8 champions who, together with a technical team, have now co-authored a cookbook with 50 menu templates based on the Mobile Teaching Kitchen initiative in Kolkata. You can see a blown up picture of a millet upma, which is basically an example of how each of the menu templates contains 120% of the day's recommended allowance for micronutrients, 2/3 class 1 protein requirements, following a vegetarian diet with the use of eggs where people do eat it, but with substitutes where they do not. And this cookbook is actually now purchased all over the world digitally. It comes with a number of video tutorials, and the revenue from the cookbook goes back into the micro enterprise, enabling these 8 champions to not only sustain their own livelihoods, but also give back to their own communities. So one of the ways in which they and the group have been giving back to the community is by forming a cooperative society under which there are also literacy, they're called little literacy libraries in the base slums where the initiative came from. And that links literacy, bilingual literacy, with child development and the provision of better nutrition education, but also the provision of exemplar food using the menu templates. So it's a circular model which is sustaining the champions, serving multiple sections of society, including not just blue collar, but white collar workers, but at the same time giving back to the community and also creating an imprint for the next generation. Many of you will know of the work of Professor Nitya Rao from University of East Anglia, and Nitya led a Global Research Translation Award linked with Tigris, which has actually catapulted some of the work that she and others have been doing in tribal communities, particularly in Santal Parganas, or the Santal districts ranging from Jharkhand and Bihar through West Bengal to Orissa. And we were able to also take the transferable elements of the mobile teaching kitchen technology and actually provide a recipe book that supports diet diversity, practical application, and sustainability by using recipes that are very close to what people are already used to, but reformulating them. And this is just an example of how we do that mathematically, that we look at dishes. So rather than screening people for deficiencies, we look at the dishes themselves. And rather than painstakingly collecting individual level food frequency or dietary data, these commonly used meal templates are screened overall, and so are the dishes. And then we do some food swaps between the templates so that each template is sufficient in all of the nutrients that are listed on the right-hand side. We use a variety of different pieces of software, and there's quite a technical team behind the scenes. And then we adapt all of those recipes. So you can see that there were 6 templates that we analyzed, and all of those 6 we reformulated, particularly addressing nutrients of concern, but also keeping in mind the acceptability and practicality of application. And doing this in tribal communities is a really good test because they have very limited resources, as you can know. There's a lot of seasonality, a lot of foraging, a lot of movement of the community. So if we can actually get this right for one of these communities, then that provides a further extension of the model, which we can apply in many other contexts. And very pleased that tomorrow I'll be joining Nithya and others in the field in Jharkhand to actually inaugurate the first Santhal recipe cookbook with this technology. In Kolkata, we are extending by partnering with Calcutta Rescue with support from the Azim Premji Foundation. And there, what we've been able to do is take the minimum common denominator from the Mobile Teaching Kitchen initiative and now widen that to an intervention program across 6 additional slums in Kolkata. Some of these slums, like our own, are registered, and so they receive some services such as ICDS, and others which are unregistered have a fluctuant refugee population, and these slums include roughly half and half. And from there, we are recruiting further champions. And what is really interesting and impressive is the cognitive flexibility and mentalizing skills of the women in these very marginalized communities is so much so that it would probably put some of our students to shame in terms of their ability to learn, assimilate, and implement. And I think on the contrary, when we've worked with local volunteers, we've had more challenges, and even with some of the doctors that we've worked with, for them to first unlearn some of the things that they thought they knew in order to make space for new things. And so this is something incredible because it means that nutrition literacy can move quite separately to literacy and even health literacy at large. So local to global, so we are looking to pilot this across regional networks, and we're very pleased to say that there's an adaptation in Mexico, which is already underway, and this is in year 2 through Tec de Monterrey in 2 parts of Mexico, Mexico City and Guadalajara. So there is a Mexican cookbook and Sodoto intervention, and all of the same recipe analysis and disaggregation has been done. The micro-enterprise phase is yet to happen. And in line with the White House initiative and in collaboration with the NIH, we've also received funding to implement pilots of the MTK in New York City and also in Washington, DC, particularly because, as many of you will know, despite being such a wealthy country, there are some deep pockets of food and nutrition insecurity in the United States, but also the model in both Mexico and the US gives back to the model in India, and the model in India continues to provide further translatable insights. So very much a cross-border initiative. That's just a snapshot of some of the volunteers who are training the champions in the mobile teaching kitchen in Mexico. And we're very lucky that earlier last year we were recognized with a Program Impact Award by the Learned Society for Nutrition, Education and Behavior. And this has really catapulted the initiative into the international arena, and we're just about to receive support to conduct an adaptation in inner city London, targeting South Asian communities who are relatively deprived, but all of whom have been experiencing acute food insecurity during the pandemic. So some of the insights that we've gained on particularly the goals of a successful intervention would be the need to support different stakeholders. So taking that multi-stakeholder approach rather than focusing only on the intervention and surrounding groups of participants. Delivering healthy food options whilst also building longer-term foundations of food security, which means that the connection with food production has to be there. And actually using education as a measurable tool to look at reducing the burden of diet-related disease, particularly by embedding the right measurements at the right time points and to the right extent, and then listening to the findings of those measurements in order to maneuver and reaching those who are most affected by poor dietary outcomes to create models which can then be built upwards to multiple additional communities. Of course, there's an impact of the intervention itself on improving flexibility and mentalizing skills and livelihoods. But really, as I was alluding to earlier, this uses a theory of change based on culinary microenterprise, but it connects with food production, food choice behavior, and health outcomes, and therefore is something that can be more practical and at this moment is probably ready for further adaptation, spread, and scale, not only internationally, but now within India. So with that, very happy to take any questions or comments. Thank you very much.
Would we take the questions now? Would you like to give some remarks before we take questions? Or how do you want to?
Yeah.
You'd like to? Yeah, okay.
Online
Yes, we can.
also.
Yes, sure.
So, yes, good afternoon, everyone. And thank you very much, Shumon, for that really nice talk. I think you explained or you demonstrated a model which has wide applicability, which can be seen from the fact that various countries, apart from places in India, want to now take it up and try to expand it, obviously making local contextual modifications, but, based on the same principles. So I think, I'm sure the audience has some questions and comments, but I think you at the beginning in the introduction identified the key problem we have today, which is really around food systems and the fact that we have to think upstream and we have to think of solutions that make healthier diets a feasible option for people. I think everybody would like to have a healthy diet, but in many cases it's not affordable, it's not practical, it's not available. And therefore interventions both on the policy side, but also on at the community level, at the individual household level, that enables people to have a healthier food or a diet is very, very welcome. I had a question on sustainability, because clearly any such model, you mentioned a micro enterprise, you need obviously some seed funds, I suppose, to get it going. But and you mentioned that these groups are now actually cooking these meals, delivering them at the same time, delivering health education. But has it been sustainable? Because in many such, healthy food is not inexpensive. So if you really want, of course, by using locally available products and affordable, you can still create, I suppose, a healthy healthy menu, but people have to be willing to pay for that. And I was thinking of a model in Tamil Nadu, for example, where they have these Amma kitchens that were set up many years ago and that provide very, very subsidized meals. And, have become very popular, but I think it's basically a cereal-based, a carbohydrate-based meal that gives rice-based in this case, which gives you the calories, but I don't think is nutritionally a very balanced. So while you were speaking, I was thinking of, can we work with a system already set up by the government to provide affordable food, 3 meals a day to the poor? So in less than 10 rupees, I think you can have these breakfast and lunch at least. How do we make it work with the maybe existing programs instead of changing the program completely? I was thinking of how can we build something like this using local self-help groups or other women's groups, because when the Amma kitchens were set up also, I think the idea was to empower women and to give them a source of livelihood. So the cooks and the servers in most of these kitchens, I believe, are women. But I think that what is missing maybe is the nutrition part of it. So those were the 2 questions I had. And then perhaps, Sangeeta, you can moderate the question and answer from the audience, including the online audience that we have.
Thank you very much, Dr. Swaminathan, for that very important question. So this is a question that does come up all the time. So if you look at the SOFI report, the State of Food Insecurity report, I think one of the major challenges is to make things healthy, affordable, and accessible. And that requires a lot of knowledge, actually. And I think that in this particular model, it takes a few years of investment in that technical knowledge and the R&D in order to come up with the menu templates that are within a particular price cap. So here in Kolkata, we set the price cap as 25 rupees. So not as cheap as 10, but still actually pretty affordable. And if you're relying on common knowledge, then people will select healthy foods that they know of, which tend to be more expensive because those are the foods that perhaps higher socioeconomic classes have gravitated towards over the years. But actually with the right dietary knowledge and with the right knowledge of crops, where to find them, and even how to grow some of them on a very small scale locally, whether you call that a kitchen garden or urban agriculture, you can actually design these templates to be highly nutritious, tasty, and inexpensive at the same time. But in order for the micro enterprise part to be sustainable, profitable, and sustainable, so it needs to operate in multiple parts of a given geographical area, operating what I would term as a Robin Hood model. So for example, in Kolkata city, so just day before yesterday, we had a selling session of the mobile unit in the Arjikor slum, which is, I don't know if anyone's been to that part of the city, but it's the slum that receives a lot of the influx of migrants from Bangladesh and also some Rohingya. So you can imagine that people are not going to buy anything there that costs more than 30 rupees. So the price point there is 30 rupees. It's still meeting the cost price, which is 25. So the MTK champions are still making a 5 rupee profit per meal. So that is where, if there are sufficient numbers, then there are economies of scale, number one. Number two, because there's a mobile unit, the next day it can move to the High Court, which is actually one of the most popular places in Kolkata, where judges, lawyers, and really white-collar workers buy the same meals. So there are different templates, but from the same range of templates for 80 rupees. And they're more than happy to do that because they would easily spend more than 100 rupees to buy much less nutritious food that's available. So that actually subsidizes the areas which are more economically challenged. So this requires a very good enterprise strategy. and one that is dynamic and responds to customer feedback and needs. So when we collect data from the public, it's not just about whether or not they are learning from this. We also collect feedback which allows us to adapt the strategy. So I'm pleased to say that after 3 years of operation in Kolkata, the mobile unit is breaking even and making a small profit. But of course, we are still subsidizing with grants all of the R&D. A point will come in the next couple of years, so our target is 2025, when in fact the R&D will be subsidized by the profit from the micro enterprise. And we have projected the figures with people who understand them more than me, and it is possible, it is achievable. It simply requires a lag period that is about 4 to 5 years for this to be established as a single unit enterprise. However, if this were to turn into a franchise cooperative model, because of the scale, this is something that actually could shorten that lag period from 4 to 5 years. And I think 5 years is a longer estimate because we had the pandemic in the middle. So it could shorten the lag period probably to about a couple of years, because 2 to 3 years was our original predictive estimate on when this would be able to break even. In terms of whether it's sustainable, so that requires not just training one set of champions, but continuous inflow of champions. And the way in which champions are trained, everyone in the community gets mass training, and then a few are selected based on performance to become the champions. So every time we continue to strengthen the base, the human resource base for the champions, we are creating a further imprint on that particular community. So the answer is yes, it is sustainable, but it requires quite a lot of technical expertise behind the scenes, and the business model is complex, but absolutely achievable with the right brains at the table. And that is the bit which requires the R&D investment upfront and on an ongoing basis.
You'd like to take a question online? There's one. Would you be able to? You want me to read it out loud or?
Oh. So yes, so we did this in pilot.
They can read the question.
Oh, sorry. So the question is, has this actually improved nutritional intake due to, sorry, has the improved nutritional intake led to improvements in nutritional health indicators? So because we can't measure nutritional health indicators on all of the general public, we rely on nutrition knowledge, attitudes, and practices data, or subsets of those data that we collect from public feedback in order to look at whether or not those proxy indicators of nutritional health have improved. But in the community of champions that we trained, we also did physical measurements to look at whether or not there had been improvements to key indicators of malnutrition and nutritional deficiency. And we found that in 6 months' time, all of those indicators had improved. So this is a debate. Should we be measuring nutritional status on everyone? My personal take on this is no, it's impossible to do. We do have, in many countries, including in this country, national nutrition surveys. Perhaps those ought to be more targeted, to be sensitive to different population subgroups. And from time to time, there can be sample surveys that are done particularly in target populations, but that would not be trackable to individuals. It would look at a group or community overall. Just speaking from a different piece of experience, so I had the privilege of serving as the UK government's lead clinician for the National Diet and Nutrition Survey in the UK for over half a decade. And during my tenure, one of the things that we did was to actually create more geographically sensitive reports on population nutrition surveillance so that we could look at the impact of government interventions, which are mostly through mass health promotion, and see whether over a period of 10 years there's been any change to statistically representative subsets of the population. Now, that costs a lot of money, but there are smaller elements of that thinking that can be brought into more cost-effective methods of surveillance. So in answer to the question, yes, we've done it in pilot. We do it by proxy, and there can be more clever methods of sample surveillance that give us periodic data.
Thank you. Yeah, Dr. Rama.
Thank you very much for the presentation. It was very enjoyable as well as interesting. I think you made it that way with all the intercommunicative presentations. But the question I have is, do you perceive of this? Ultimately, what is the aim is to improve the dietary intake of the communities, or is it to generate also through that process a business model for women too? So there seem to be two objectives, and whether how do they go gel one in one? And the other thing is that how often, how many communities does one mobile kitchen serve? And there should be, I think there will be a limit to the number that they can serve, and whether it would help in contributing to break even, and completely when they have to take over at one point, whether it will help. That was the second. And third is, do you have at this point of time any information on how household dietary patterns have changed, or anything has been, what is the takeaway for the people from this? Have you any information on that?
So thank you. Those are three, again, very relevant questions. So in regard to the first one, I think those are spot on. So your two derived objectives are certainly, amongst the top few objectives. So one objective, but the two that you just articulated must always be interlinked. So we cannot have the micro enterprise without improving diet and health awareness. We cannot have the diet and health awareness without improving the micro enterprise in that community. So the two in this model are inextricably interlinked. So you're absolutely right. Those are the two main objectives. There are others. And the reason for that is the theory of change I was alluding to earlier, which is that at surface level, this is a method of improving lives and livelihoods. But behind the scenes, the method as a side effect actually improves nutrition and health. So that is a side effect. It's less explicit when it's presented, but it becomes absolutely evident to all of those involved and needs to always stay close to it. And just to exemplify why I'm repeating that a few times is because there've been a number of instances over the past few years when the micro enterprise could have gone off the rails, because there are a number of things that people could have done for profitability that would have gone against the health and nutrition messaging. And so it's a careful balance of going slow and steady. I think your second point, just remind me.
What is any information on household takeaway?
Your second point on information in household improvement. So again, that has been done in pilot surveys in the community, the two base communities where the mobile teaching kitchen has run. And there has been measurable improvements, not only to nutrition knowledge, but there we've measured more improvement, or rather we've measured changes to nutrition practices. So the culinary practices have changed, and also the awareness of menfolk in these communities has changed quite considerably. Some of that has actually been measured in a small subset. The other area where this has had an impact is that in these communities, many of the people work as domestic help, and they have been encouraged to go onwards to the people that they work for and see what impact it would have if they were to actually convey that messaging to higher socioeconomic classes. And that is something that has been has worked, surprisingly well. And we've collected a small amount of feedback on that. I would love to collect more data on that, but due to logistic limitations, we've only done that in sample survey. And please remind me of your third one again, short-term memory issues.
How many communities does one kitchen serve?
Yes, so one kitchen in Kolkata serves 8 different catchment areas. The capacity is 3,000 meals per week at the moment, but that is only working for the lunch session. So that starts at 12 and finishes at 4. If the mobile unit were to have more champions, increase the rota, and to work for breakfast, lunch, and dinner, then it would double or potentially triple the capacity. But instead, what has been done is a base kitchen has also been formed, and there are negotiations ongoing in final stages with an app called Swiggy. I'm guessing you have that here as well. So to disrupt the online food business market, where actually when people order online, so that will amplify the sales, but everyone, whether they want it or not, they will have to order from these healthy template menus. And again, whether they want it or not, they'll get the health education material. And if they fill in the feedback forms, they'll get discounts on further orders. So this will gradually disrupt that market. And our hope is that other competitors on Swiggy will gradually begin to follow suit. So that is not something that will increase profitability to the enterprise itself, but it will amplify the impact or messaging. So it could go one of two ways. Either that's what will happen, or the other competitors will close in, but that's an experiment that's yet to happen.
Just excuse me if I'm permitted to ask one more question, or you want to go around with
Yeah, I
others?
think we'll just wait for a bit. So I think there's questions online. Should we go to the second question, please? Will this model be able to expand pan-India with the same affordability of food? If yes, what are the steps, and what will you do?
So we actually had, so when we launched the micro enterprise in August 2018, there was a lot of press coverage, and everything was featured on page 2 of the Times of India. And we suddenly had like hundreds of calls to, think about this at scale. And potentially there would be funders who would even support that. But we've purposefully waited because we wanted to achieve enough depth in this model, enough data to tell us which things do not work. And of course, I'm presenting mostly the things that do work, but we have a plethora of failed experiments behind the scenes, which tell us where the bugs are. So going back to expanding pan-India, I think, like that slide showed, more data will always be needed. So now we have enough data to think about spread and scale. The adaptation in other countries is different because in each of those countries, we're starting from ground zero. So we'll go through the same stages of learning. Here now, the micro enterprise is underpinned by a legally registered not-for-profit cooperative society. We have the insights and we know some of the fallacies. So with the right risk management, it is ready to be scaled over the next 2 years. The next one, is it only women or men?
Yeah, no, he says, I believe men and women have differential nutritional requirements, and nutritional related issues are also different. So how do you address the gender issue?
Right. So remembering right at the beginning that I said this focuses on primary prevention and health promotion. So we go forward with a big disclaimer that we are not treating nutritional deficiencies through this intervention. We are promoting how to prevent nutritional deficiencies by giving people a visual and sensory imprint of what multiple menu templates could look like if they had all the nutrients required on a single plate. The 120% of recommended daily allowance of micronutrients applies to men and women. For most of those micronutrients, women would be getting a little more than their average requirement. Of course, the requirements vary not just by gender, but by so many other factors, by body mass, by also disease-related malnutrition, and so many other, I would say, comorbidities, which could increase or decrease different nutritional requirements. But going back to primary prevention, we're not trying to treat disease. This is mainly health promotion, and it's mainly for those who are looking to prevent. So it's based on the assumption that we're dealing with free living individuals without comorbidities, but we do explain to them at every contact point, this is not something that is a therapeutic diet. If you feel you have a nutritional deficiency or that you have a clinical nutrition problem, you must consult with a health professional. And for those who don't have the means, we also signpost. So I think there is another secondary question related to that, which is to do with
Expansion again.
expansion. Yeah, so that's quite a specific one related to Orissa. So actually, interestingly, we did a demo session in Bhubaneswar in 2019, which was very well received. And we did that with Orissa Millet Mission. And one of the outcomes that had is that the Orissa Millet Mission, and I think MSSRF is indirectly involved in that because of the site in Koraput. So the enterprise that had arisen from those millets were focused mainly on festivals. And although the millet is so healthy, the culinary practices that were being used was not necessarily turning it into something that was healthy to consume. So one impact that had was to impress on that entire group how they should think about food preparation and formulation, because however healthy your crop or source ingredients are, once it goes through processing, it ends up somewhere else. So that's what we've done in Orissa so far. And from that experience, going back to that question, again, as we think about pan-India spread and scale, certainly Orissa should be considered, but we will have to come up with a strategy, find ample startup and R&D funding, and then proceed over the next couple of years.
We are a little beyond time, but if there is a burning question that you need to ask here at this forum, you have a question. You take the mic, please. Take the mic, please. Yeah.
Yeah, very interesting presentation. Thanks for that. And just wanted to, very curious about the diet plans that you have planned or the recommendations that you give for the women to follow. Does it include both vegetarian and non-vegetarian diets? And do women give non-vegetarian diet in the kitchen that they go for? Yeah,
So firstly, they're not diet plans, because a diet plan is something that's individualized to a person's requirements and takes into account comorbidities or any disease-related malnutrition. So what we are creating are dietary patterns that will apply to 2/3 of the population, but remembering that 1/3 of the population is probably going to need different dietary and non-dietary interventions to deal with deficiencies. So that's just quick clarification. Everything is lacto-vegetarian. The use of a boiled egg is permitted for those communities which eat eggs, but we purposefully have opted for a plant-centric, not plant-based, but plant-centric, because we have milk products in it, approach, because that's much more interoperable across different faiths and communities. So particularly in Kolkata city, there are some individuals that we serve who are purely vegetarian and some who are not. But I think the base of every single menu template is vegetarian. So the egg is an optional extra. And even in other countries, we are not introducing meat and fish. This is a debate, but the reason we're not doing it is not only because of interoperability, but also because of cost, and also because of food hygiene and storage. and the risk of contamination. So there are many different factors involved. So the risk managed approach is vegetarian, and for those who take it, over lacto-vegetarian. In New York City, we're going to develop a vegan menu set of vegan menu templates as well. So that's going to be a new challenge, but again, plant-centric.
Thank you so much, Dr. A. I think you've given a very detailed explanation and for taking all the questions posed here. And I'm sure there's many more to come. And probably we could share details if there's any, separate questions that come to us, to you, and then you can answer them. So thank you so much for joining us online, and people here as well, and the speaker and the chair. Thank you for the wonderful participation.
Thank you for the opportunity. Thank you.
We have tea served outside for those here in Chennai. So we have tea and some snacks. Please, go outside, and outside the auditorium, it will be served. For those online, thank you so much for joining, and have a good evening.